Hi everyone, I'm Tineke, one of the co-founders of Five Times More.
Sorry, I'll do that again.
Okay,
And can we not say hi, I'm Tineke, hi, I'm Claire, and we are Five Times More? But you said I'm one of the founders, so it cut.
I don't remember what we did, I'm just freestyling. We
I'm
can
like,
start again.
God.
Hi everyone, I'm Tineke, one of the co-founders of Five Times More.
And I'm Chloe, one of the co-founders of Five Times More with Tineke.
And today we have the amazing Laura Bridle, who is going to be talking to us about a topic that I feel like is a very interesting one. So Laura, would you like to introduce yourself to our audience today?
Sure. So thank you very much for having me. I'm Laura Bridle and I'm a midwife working in the maternal mental health services in Southeast London. I've been doing this role for about 2 years, but prior to that, I was the mental health midwife at St. Thomas's for 5 years. So I've been in the sphere of mental health for at least 7 years now.
Perfect. Thank you so much.
Okay.
And you're obviously the perfect person for this interview. We'll be talking about PTSD, post-traumatic stress disorder within pregnancy and outside of pregnancy. So can you tell us what PTSD is, please?
Sure. So PTSD is post-traumatic stress disorder. And it's a condition that we sometimes think of like if somebody's been at war or been in like a traumatic car accident. But actually it can be any traumatic event or serious injury that happens to somebody. And distress is a completely normal reaction to an abnormal situation. So it might be quite normal for you to have upsetting memories, feeling on edge, trouble sleeping. But when it happens for longer, prolongs for like longer than a month, or it's affecting your everyday life, then that's when it might be something we diagnose as PTSD. And this can happen right after the event, or can happen weeks, months, or even years later.
I didn't realize you could get it years later.
Yeah, it's like a smell or like a sound, something can trigger something
Okay.
later on that you thought, actually, I didn't even realize that that was traumatic for me. So it can come, yeah, at any point.
And I felt like that happens a lot as well, especially in pregnancy, where you think you're okay, and then you might go back to the hospital, like you said, hear certain sound, maybe hear the buzzer or the alarm go off,
Exactly.
and then it brings back those memories. And a lot of the women I know, sometimes they don't know what's wrong with them. They think, why do I feel this way? And they don't actually know that they have post-traumatic stress disorder. So thank you for that.
No
How
problem.
can you experience PTSD in pregnancy?
Well, it's exactly like you said, Chloe, it's actually quite common. So with the birth trauma report that came out recently and some further evidence is saying about 1 in every 3 women would describe their birth as traumatic. The evidence says it's about 1 in 2 for every 1,000 births that women actually develop PTSD. But this could happen, something that happens during pregnancy, it could be during the birth or the postnatal period. And if you're thinking about,
Sorry to
yeah,
cut you. Did you say 1 in 2 or 1 in 200?
1 to 2 in every 1,000.
Oh, one
So
to every 1,000. Sorry. Okay. Yeah.
yeah, no, thanks for clarifying.
One in
I
two.
mumble sometimes, so always ask me. No problem. But yeah, so it is fairly common. Um, but I think it's probably quite often undiagnosed or underrepresented. And families who might have an admission to like the neonatal ward quite often have an increased risk of developing PTSD. But one thing that I think that's really, really, really important is that whatever a woman says was traumatic for her is traumatic. It's like when I was training to be a nurse, they said, pain is what the person says it is. So it's the same thing with trauma. I've been a midwife for 14 years now, and I've been at births where I thought, oh, that was so beautiful. And the woman was like, nah, that was not beautiful. So I think whatever the person says it is traumatic is true. So don't feel like, oh, I shouldn't be traumatized by that. I have a live baby, or I shouldn't be traumatized by that. I had a vaginal birth. Whatever you say is traumatic can cause trauma. And
Thank you.
often, yeah, often I was gonna say actually quite often it's like that feeling of loss of control or not being listened to or not being heard. Quite often we get complaints, it's quite often due to like that lack of communication or not being listened to. Sorry.
And I was going to say, once again, with the women that we support with Five Times More, when they have a healthy birth or a good birth, or things go to, on paper, things look like they're gone to plan. So to say I had a vaginal birth and it happened so quick, it happening very quickly could be
Yeah.
part of the post-traumatic stress disorder. like it says, anything that what we say is, it's not a kind of tick box. Okay, you had a C-section, that's what it is. You had, no, it's whatever you think it is. And I think a lot of women, when their birth looks like a perfect birth, they do feel guilty with feeling a certain way because their birth looks like it's a perfect birth.
That's true. I guess what is the perfect birth? And also, as we've been doing more in like talking about birth trauma and stuff like that, it's really opened my eyes. I remember at first, when I had a conversation with Chloe about like birth trauma, and she was like, birth trauma is basically what you say, is like I could have the exact same type of birth as you, and somebody experiences birth trauma because that's their, it's like pain. People have different pain thresholds, they have different trauma thresholds, and it is individual to you. I guess, I don't know, that's why it probably looks different in everybody, but there are probably some common signs and symptoms, right?
Yes,
I'll be able to pick up on, but it's relative.
absolutely. Yeah.
I guess it leads me on to my next question, because you hinted on it a little bit in what you were saying before. Are there any groups of women that are more prone to experiencing PTSD?
Yes. So definitely, unfortunately, global majority women, because if we look at the stats and statistics around mortality, morbidity, not feeling listened to, not being given pain relief, not being believed, those women understandably are more at risk of developing PTSD because they're more likely to have a traumatic birth. Even, I know I've spoken to you both about this before, like women coming into pregnancy and finding out for the first time as a Black woman that they're almost 4 times more likely to die. That's traumatic to hear, right? They just found they're pregnant, they just want to enjoy their pregnancy, and now they're like, oh, what else do I need to do to keep safe? This is, so that is understandable. And why there's increased risk of that. And that's why it's really important that women have access to things like your 6 steps. Or as healthcare professionals, we need to be really keen to be listening to women and really believing them and getting them support early. And then there's also those group of women who've had previous birth trauma, we say there's another diagnosis called complex PTSD, which came around 2018, and it's women who've experienced trauma in childhood. So when you book with a midwife, they might say, did you have a happy childhood? And the reason they're asking you that is because if you've come from a family where there was domestic violence or serious mental illness, or you yourself have experienced sexual trauma, then that puts you at increased risk of developing PTSD in pregnancy. Like we were talking about, like that normal birth, that vaginal birth, but actually having an internal examination might be quite triggering for somebody who's had sexual trauma. So there's lots of like little key things that can impact someone. Yeah, that's how it.
Okay, that's interesting.
Yeah, I'm stuck on, did you have a happy childhood? Because what does that even mean? You think your childhood was good, and then you hear something else, a child like, oh, maybe mine wasn't as good. Don't ask me to have a happy childhood. I'm just gonna say yes, like, yeah.
Yeah, and that's why it's so important to have like the right person you're talking to.
Yeah.
So, if you've booked with a midwife and you're like, I don't gel with her, I don't feel like I can open up to her, you have every right to ask for a new midwife or a new doctor, or find somebody you trust to talk to. That, like, each trust will have their own mental health midwife. So if you want to speak to somebody who's definitely going to get it, you could request to see them.
Okay.
Yeah.
That would be definitely better. We did touch on this already, but what are some of the symptoms of PTSD?
So flashbacks of the experience, nightmares about it, repetitive, constant images, sensations. There's also physical sensations you can have. So pain, abdominal pain, sweating, feeling sick, nausea, trying to feel nothing at all. So like that emotional numbing, trying to distract yourself, avoid the place altogether and not wanting to go back to that same hospital. Sorry, not wanting to be around other pregnant women, anxiety, irritability, angry outbursts, headaches. There's lots and lots and lots of symptoms that can be present. And it's that that's been prolonged for like longer than a month and definitely affecting your everyday life.
Oh, wow, some of these symptoms are kind of overlapping with postpartum depression as well.
Yeah.
Is there a link?
Absolutely. There is a link.
I'm going off.
I liked it because you're right. 10 points for Tanuki. Yeah, there is definitely, if you have a history of depression or anxiety, you can have an increased risk of having PTSD, unfortunately. And there are definitely things that can kind of cross over.
That makes sense. Also, what does it mean if you had a good experience? Sorry, I'm just using the opportunity to speak to a professional.
Yeah.
But what does it mean if you had a good experience, but you keep having flashbacks of certain bits of it and you feel nervous? Like maybe, okay. Let me just say what I'm saying. So yeah, just so that makes sense. Eden's birth was a great experience, right? I really enjoyed it. Although I haven't spoken to people, like, it could be because my birth was so bad that I would have taken anything above that. But no, it actually was really good. It was in the middle of the pandemic, so certain bits of it were very scary, very traumatic. Not traumatic, but certain bits were scary because, you know, you can't have your partner in the room and all of that kind of stuff, right? But by and large, midwife was great, had a great experience. And I just remember at one point, the I was pushing and the midwife was like, look, there's meconium on the next push. If I'm not happy, you're gonna have to come out of the pool and we're gonna have to go to the delivery suite. And I would say months after, I would always think about that particular part, like being in the pool and being really scared. Oh God, like the next push was fine. She was like, oh, it's fine. I can see baby's head. You've got nothing to worry about. You know, keep going. You know, you're doing a good job. But just that 1 or 2 minutes of being in fear, like, oh God, like, is everything okay? And I kept playing that back despite everything else around it being a really good experience. Would that count as PTSD?
Yeah.
Really?
Well, if it's still lingering, if it's still affecting you, if you still haven't been able to move on from it, then yeah, it's a trauma. That was a traumatic thing that was said to you. As women and birthing people, right? We're told that, like, you have to eat this, you have to do that, to protect this baby. And we're the sole person who can do that. It's such a amount of pressure, right? To then be said, Nick, if you don't do this, we're gonna have to get out. So you're like, you know, when you read things about meconium, and because you've had a previous traumatic birth, all those things are kind of like tick boxes for what and why you would feel like that. Yeah, as healthcare professionals, we do say stuff like that quite a lot because we want to avoid you having to have an intervention for whatever reason. But actually, the way we say things, like you've just shown, can have like long-lasting effects. So it's really important as well for us. So if there's any of us listening, please, you know, think about how we say things to get the point across, obviously, but in a safe way.
She said it in a safe way. I guess she wouldn't have known that where I was coming from.
Yeah,
right?
yeah.
But there was nothing wrong in what she said. I just think you're right, actually. The time it was and the previous experience and everything, just that particular moment in time made me think of everything else surrounding it, and that's what I kept focusing on, even though the rest of it was like perfect, literally couldn't fault any bit of it. Yeah, it's obviously not the midwife's fault. It was just, you know, it was what it was. But yeah, thank you for that, actually, because you don't know what could be. And what I remember, like, I'd sit down, I'd be breastfeeding and I'd think of that time and be really worried and like, oh God, thank God, at least everything's okay. But you know, you just push on, you just get on with it. But I didn't realize that could actually technically be PTSD. I didn't have a word for it. I didn't know it was a thing.
Yeah, 100%. And especially because your first birth was so traumatic, you know, the threshold is lower. So you might have underlying trauma that's already there, and that just kind of reignites it. Yeah.
Well, thank you.
Yeah, no problem.
Not me getting free therapy.
No problem.
Also, to add on, I was going to say, I think if I was in that situation and someone said meconium and I didn't know what meconium was, that's it. It just sounds like such a dangerous, just like, what is that? What does it mean? I think knowing about birth also helps as well. But yeah, if you put, I can see meconium's going to come if you push. Meconium, what's that? That's like my hero power. I'm going to come out. Yeah.
Yeah, it's a good one. Okay, I think it's me.
Yeah.
Question, sorry. Went off script completely. Is PTSD something that you can treat yourself, or do you need to get help for it?
So, if it's affecting your everyday life, and true PTSD, and it's a mental health condition and it's not your fault, but it's also not something you can just get over and move on from. So I would definitely suggest getting some support or help. And there's a wide spectrum of support. It doesn't always mean, you know, we have to see a psychiatrist. There's like a wide, like we call step level care of what you can access.
So if someone has PTSD, a bit to what Tanuka said, who should they go and see? Do they go to a GP to get a referral? Who's their specialist? So I've given birth and I've got PTSD. Where do I go? Who do I go to? Who do I see?
So there's lots of different options of support. Unfortunately, there is still a bit of a postcode lottery with certain things about where you are, what's available. But one thing that is across the board in England is talking therapies. And that's like the first step level of support you can get access for something like PTSD. You can self-refer online. There's even a website, NHS Talking Therapies. You put your postcode in and it will tell you where and how to self-refer. Or GP can refer you or your midwife. And they can offer something like CBT and some, which is cognitive behavioral therapy, which is like a talking therapy that kind of talks about how you're feeling and how to kind of change those feelings into a more positive thing so you can carry on with everyday life. And then there's also EMDR. So some other psychotherapists and psychologists within the talking therapies are trained in how to do that as well, which is like they use eye movement to kind of dampen the symptoms of trauma. If you've accessed that before and you're actually like, that did not work for me, that's not what I need, or you have more severe form of PTSD, so you're not going out at all, you're not get bonding with baby, we're really concerned about you, or your partner might be the first person to actually say, look, there's something going on, we need to get you some help, then you might want to access a perinatal mental health team. If you're pregnant, and that's a psychologist, psychiatrist, mental health nurse, nursery nurse, a wide spectrum of team, and you can kind of pick from the team that you need. And there's also maternal mental health services, which I'm part of now. And they're just under 3 years old now, I think. And there's still some opening up and down the country. And they are psychology led. So there's a psychologist and there's normally a midwife like me, and then an expert by experience coordinator. So somebody who's had experience of trauma, who work with you to kind of things like EMDR, but peer support, peer groups, birth trauma reflections. Yeah, so there's a wide spectrum of support. There's also even community mental health teams. So if you weren't pregnant and this happened 5 years ago, but something's happened to trigger it, then you can also access your community mental health team if talking therapies aren't the right fit.
There's a lot of support that I was not aware of. I don't know about you, Tanuka. I'm just like, wow, all this is out here. Where's the information?
Exactly. I'll send you a link for London. There's a good one for London where you can put in which area, northwest, southwest. Obviously, South London's obviously better, but you know, there's some across North London. But there you can find out what talking therapies is available, what is a perinatal mental health team, how do I refer, what is a maternal mental health service, what peer support is out there as well. But we need it for the country for sure, because it is hard to navigate.
No, that will good to add it to the end of this video. What in the
yeah,
that'd be good actually.
Yeah, we'll definitely add it to the end. Now, I've got a bit of a tricky question based off of what you said and based off what you've just said in terms of what the help is available. Is there a cutoff? So if you had your child, like, I don't know, 5-10 years ago, and you're now pregnant or something has triggered it or something like that, and you're like, I can't get over this, can you still access that help, or does it have to be within, you know, some services are 2 years, within 5 years? Are there cutoff points for like certain things?
So unhelpfully, every team does things differently. Talking therapies, there's no cutoff. You can access that whenever you need to. So that's like the first step level. So CBT, and some offer EMDR, and some offer like peer support as well. There's also amazing peer support online with things like Birth Trauma UK and other organizations local to your area. Maternal mental health services are different up and down the country. So like the team I'm part of only support those who've had perinatal loss. They don't support birth trauma. But then there's other ones that offer birth trauma. So they might, if you become pregnant again, they will definitely support you. if it's happened 5 years ago and you're not pregnant, but it's still affecting you, then a community mental health team would be probably the best point of access. But linking with organizations like Birth Trauma UK, you can find and speak to other peers on there to say where did you access support, what was helpful, what wasn't helpful, to kind of help navigate. Yeah.
So you've just had a baby. Who's your first point of contact? Who should you first talk to if you think you have PTSD? Is it your community midwife? Is it a health visitor, your GP? Who's the right person?
If you're still pregnant or you've just given birth, then and you have a good relationship, I would speak to your midwife, because they can refer you to any service that you need. If you've been discharged by the midwife, you could ask your health visitor. And there are specialist health visitors that are specially trained in mental health if you wanted to speak to them directly. Or you can speak to a GP at any point in your journey. So they're obviously the person that's the continuity throughout your life that you can go to. But if whoever you go to speak to, it can be really difficult to then re-talk about what's just happened. It can be really stressful. And if you're going to see a GP, the appointment might be 5-10 minutes. So my recommendation would be definitely to write things down. So those key things that you want to get across, and take someone with that you love and trust and care about, because like I said, it's quite difficult to remember what's happened and what it's brought you there today. So you may not take in everything that the doctor or midwife has said to you. You might forget a few things. Having that like champion beside you, advocate, can be like, oh, do you remember they said this? And or can just be there to hold your hand if you're finding the situation difficult. I would hope that that's all you need to do. But if you felt like you weren't heard or weren't listened to, then just see someone else, ask to see someone else. There's no problem with that. Yeah.
Maybe might it be worth booking a double appointment if it's the GP, because you do only get 5-10 minutes if you can even get an appointment. Hey,
I
worth booking a double appointment, if possible, or maybe letting the midwife know that you might need some more time, extra time, and they can make accommodations for that, because it is very sensitive trying to talk about your feelings, especially if you haven't written them down, or if you have written them down and you just can't articulate yourself enough. It might be worth trying to get that extra time in rather than feeling rushed and like you haven't got the support that you need.
100%. And most trusts will offer a birth debrief, if that is something that would be quite helpful. That might be like the first thing you want to try. Like, I don't remember why this happened, or I don't remember what happened then. So you could ask to see the consultant midwife, or you could ask to see a professional midwifery advocate. So each trust, again, sorry, unhelpfully, do things slightly differently, even in Southeast London. So it'd be helpful to then find out, okay, at Lewisham, I know I can see a professional midwifery advocate. I'll book that in. I can self-refer to that. Whereas like at St. Thomas's or King's, you might need to see a consultant midwife and have that referral made for you. There are also other people that can offer them separate to the NHS. Sometimes that's quite helpful. Big shout out to Illy Morrison, Mixing Up Motherhood. She's an incredible woman, so you might be something to follow to get some advice and support about how to navigate after having birth trauma. So that there's not like a one size fits all, but there are definitely different things you can access that can help you navigate to next steps.
I love that.
Yeah.
Claire, have you got any other questions off the back of that?
No, I don't actually. I think Laura's covered so much already.
Great.
Yeah, she definitely has. I guess the one final thing is, Laura, give somebody who's watching who might potentially think they have PTSD or has PTSD, what's one piece of advice you would leave for them?
It's not your fault. And please speak to someone you trust to get you the right support. My advice.
Thank you so much. This has been a really, really informative episode. We will link all of the resources in the caption below, and don't suffer in silence.
Yeah. Thank you.
Thank you.